Hi all, welcome to Eduwizz Academy. If you are preparing for licensing exams to the Gulf countries like DHA, DOH, MOH and Prometric, and Eduwizz Academy is providing online education program. It is an online application program. It includes 35 hours of exam oriented theory classes recorded in HD quality. It also includes so many features like premium questions, study materials, exam practice test, video discussion classes, and most importantly, faculty assistance. So, if you want to know more about the details of our application, please contact us. Okay. So, let's go straight to today's discussion class. First question: Maureen, a primary gravida client, age 20, has just completed a difficult forceps assisted delivery of twins. Her labor was unusually long and required oxytocin augmentation. The nurse who is caring for her should stay alert for A. Uterine inversion, B. Uterine atony, C. Uterine involution, and D. Uterine discomfort. So, a primary gravida whose delivery has been conducted with oxytocin augmentation because the delivery was difficult, and also they have to use forceps to assist in the delivery. So, what problem might occur after delivery? So, the nurse should be aware or careful or should be alert for which problem which might occur after delivery. That is the question. So, in the question, it's clearly mentioned that there was difficulty in delivery and forceps has been used and oxytocin has been augmented. So, why oxytocin is used? Oxytocin is used to increase the contraction of the uterus. So that is why the labor was difficult and that is why it was unusually long. The uterus was not contracting properly. So what happens if the uterus is not contracting properly after delivery? That is the question. So first thing, the term which is used to describe the inability of the uterus to contract is called uterine atony or atonic uterus. So what happens is if the uterus does not contract properly after delivery, it will lead to postpartum hemorrhage. After placental separation, the capillaries at the uterine wall breaks and this lead to slight bleeding. The uterus has to contract continuously after the delivery of the placenta also to close these capillaries. Failure to do this might result in excessive bleeding, which is called as postpartum hemorrhage. So, because the patient's delivery was difficult and it took you unusually long time, and oxytocin has to be used, it indicates that uterus is not contracting properly, which is called as uterine atony. Okay. So, why is it important? If uterus is not contracting, it might lead to postpartum hemorrhage. So, answer is option B, uterine atony. Let's look at the other options also. First is uterine inversion, which is also a complication which occurs during delivery. Mostly it occurs while placental separation because of extra traction of the placenta at the uterine wall or because of the pressure we used while removing the placenta. What happens is the inside of the uterus comes out. Okay, it might lead to prolapse of the uterus as well. So that is known as uterine inversion, okay, which occurs during placental separation. Okay, and third option, uterine involution, is a normal process. After delivery, the return of uterus into the pelvic cavity is called as uterine involution. Okay, so that is normal, and uterine comfort is also normal. There might be some discomfort after the delivery, so which is expected or which is normal. So here the answer is uterine atony. Okay, answer is option B, uterine atony. Second question, the uterus returns to the pelvic cavity in which of the following time frames? Just like we discussed in the first question, it is known as uterine involution. Return of the uterus into the pelvic cavity after delivery is known as uterine involution. So here the question is about how much time will it require for complete uterine involution or for return of uterus into the pelvic cavity. 7th to 9th day postpartum, B 2 weeks postpartum, C end of 6th week postpartum, and D when the lochia changes to alba. So for subinvolution, subinvolution is failure of the uterus to return to the pelvic cavity. Okay, so there are two terms, uterine involution and subinvolution. Uterine involution means return of the uterus into the pelvic cavity, which is a normal process, and subinvolution is failure of the uterus to return to the pelvic cavity. So question is regarding uterine involution, and the time required for uterine involution is 7 to 9 days postpartum or maximum 12 to 14 days. Okay, so that is the question. So here answer is 7 to 9 days of postpartum. Okay. Next question. To promote comfort during labor, the nurse John advises a client to assume certain positions and avoid others. Which position may cause maternal hypotension and fetal hypoxia? So during labor, we provide position for the mother. There are certain positions to be provided, and there are certain positions that should be avoided. So question is, which position may cause maternal hypotension and fetal hypoxia? Options are A. Lateral position, B. Squatting position, C. Supine position, and D. Standing position. So which position causes complication? That is the question. And the complication is maternal hypotension and fetal hypoxia. So lateral position is the first option. The usual position which we provide for lying down mother is lateral position. And the reason for providing lateral position is to prevent the pressure of uterus on the vena cava. If you place the mother on the supine position, what happens is the uterus applies pressure on the vena cava, which leads to decreased blood return to the mother, resulting in maternal hypotension, which ultimately leads to fetal hypoxia. So the position that should be avoided is supine position. Rest of the positions are normal. Just like I said, usual position which we provide for lying is lateral position. Squatting position is also a normal position which we provide. Even sometimes squatting position is used to conduct labor also. Okay, it helps in the proper alignment of the baby with the uterus, and it also helps balance in the gravity also. And standing position is also normal. That's why we encourage walking for the mother also. So the unusual or the position that should be avoided during pregnancy is supine position. The complication that causes due to supine position is known as maternal hypotension or supine hypotension. Another name is vena cava syndrome. As it causes pressure to the vena cava, it is also known as vena cava syndrome. Okay, so answer is option C, supine position. Next question, RH isoimmunization in a pregnant client develops during which of the following conditions? Options are RH positive maternal blood process into fetal blood stimulating fetal antibodies, RH positive fetal blood process into maternal blood stimulating maternal antibodies, RH negative fetal blood crosses into maternal blood stimulating maternal antibodies, RH negative maternal blood crosses into fetal blood stimulating fetal antibodies. So all these options are related to RH isoimmunization or the problem which is called as RH incompatibility. So what is RH incompatibility? It occurs when the mother's blood group is RH negative and the baby's blood group is RH positive. It leads to antigen antibody reaction in the next pregnancy. So the most important point is mother's blood group is negative and baby's blood group is positive. Okay, so what happens during pregnancy? The positive blood cells enters the maternal blood through placenta, which causes antigen antibody reaction and it stimulates maternal antibody production. So in the next pregnancy, what happens? These maternal antibodies crosses the placenta and reaches fetal blood, resulting in severe destruction of the blood cells of the fetus, which is known as erythroblastosis fetalis. So most important point is mother's blood group should be negative and baby's is positive. And second thing, baby's positive blood group enters the maternal blood and causes maternal antibody stimulation. And in the next pregnancy, this maternal antibodies crosses placenta and reaches baby's blood causing destruction, which is known as erythroblastosis fetalis. Okay, so here options are Rh positive maternal blood. So just like we said, mother's blood group is negative. It occurs only when mother's blood group is negative. And B, Rh positive fetal blood. Okay. C, Rh negative fetal blood. We said that baby's blood should be positive. Okay. So there are two options: Rh positive fetal blood and Rh negative maternal blood. So we have to see Rh positive fetal blood crosses into maternal blood. So this is what we discussed: stimulating maternal antibodies. Fetal blood crosses into maternal blood, stimulating maternal antibodies is the answer. So answer is option B. Next is Dine, 24-year-old, is 27 weeks pregnant and she arrives at her physician office with complaints of fever, nausea, vomiting, malaise, unilateral flank pain and costovertebral angle tenderness. Which of the following diagnosis is most likely? So a 27-week gestation mother who is 24-year-old reaches the physician office with several complaints. So out of these complaints, by seeing all these complaints, which diagnosis is most likely? That is the question. So coming to the options: A, asymptomatic bacteriuria; C, bacterial vaginosis; C, pyelonephritis; and D, urinary tract infection. So what is the most likely diagnosis? So let's see about the options. In the first option, it's clearly mentioned that asymptomatic bacteriuria, which means there will be no symptoms. But here, patient presents with several complaints. So first answer is wrong. Second thing, bacterial vaginosis. It's a bacterial infection in the vaginal area which causes vaginal secretions. Apart from that, there will be no symptoms. It will not affect systemically. So that is the feature of bacterial vaginosis. There will be vaginal infectious secretions, but there will be no systemic involvement and there will be no particular other symptoms. Okay, so B is wrong. Coming to the rest of the options, which is pyelonephritis and urinary tract infection. Pyelonephritis is also a type of urinary tract infection. So by seeing the features, we have to differentiate it. So in urinary tract infection, the most important features are dysuria, urgency and frequency, and most importantly, the pain and tenderness will be at the suprapubic region. Okay. Now coming to pyelonephritis, most important features are the pain and tenderness will be on the flank region and in the costovertebral angle. Okay, so flank pain and costovertebral angle tenderness. So answer is, because the area, by seeing the areas and the complaints, it is option C, pyloric nephritis. Okay, so now let's see some points regarding pyelonephritis. Pyelonephritis in pregnancy is a urinary tract infection that can occur during pregnancy and is a most common cause of serious infections. It might lead to serious infections. It's most common in the second trimester. Okay. So what are the clinical features of pyelonephritis? Fever, as there is infection, flank pain, tenderness, which is located on the costovertebral angle, just like we saw in the question. The tenderness will be on, pain will be on the flank region and tenderness will be on the costovertebral angle, and nausea and vomiting. These are the symptoms. Okay. So what differentiates is the location of the pain, and in urinary tract infection there will be dysuria, urgency and frequency. In pyelonephritis also there will be dysuria and urgency, but main differentiation is the location of the pain. In pyelonephritis, pain will be on the flank region and tenderness on the costovertebral angle, but in urinary tract infection, tenderness will be on the suprapubic region. And the the complications are septic shock, preterm labor and premature delivery. Septic shock, preterm labor and premature delivery. That's why it is called a serious infection. It might lead to serious complications like septic shock, preterm delivery and premature labor. Okay. And treatments are IV fluids, IV antibiotics, paracetamol, tepid sponging, and fanning. To promote urinary elimination, we increase IV fluids, and to treat the infection, we give antibiotics IV and paracetamol for fever and pain, and last tepid sponging and fanning, which is also used to relieve fever. So these are the treatment used for pyelonephritis. Thank you.